So what I do is we studio here is of the idea I will be great for about the specific but video frame of how an allergic so again, the orders we are application. We will ask patient summary, behavioral analysis, reality, drugs, and then we are and the severe diagnostic aspects and waiting. So, side effects can be likely needs part of that. We find that the people from effects will make us happen. That is the case that request positive prevention of if we need to get the strategy, we get the news get it better. Sometimes we need to stay in this and but in our own what is there, we have which first, what is between that. Next, to kind of have your first insight is tolerance, classified, allergens, etc. We have these allergens. Finally, we try to reach that one sample stage, get it of it, and we are able to talk to the left of that. So, you can not start the advance in consider or the better myself, or it is able actually back way, and for these girls, attached to our own body, that is working into it, or it is not that we responsibility not get represented that is happening. So, in this allergy strategy period, the person starts we look to see the weak system not certain company, or if it is working, it is not very bad. And just try to be actually the baseline of the practice of the game. So there's just hard at spinal care because only patients are identified and socially hard, then we first the new specific care, we find that nothing happens like this. So that is why that this is primary care and hospital care stay on. And because if it is not recognized, allergic and immune problems, or activity is not recognized, then you find the next patient is certainly later. And that's why we have so many sort of lectures to private classes, doctors, etc., and vice versa, that can be made of others thinking about. We are trying to look at the very important forum that is present of the course, forms that area. So the next one is that if you look at the immune system, if you look at the last phase, we have the eosinophil in the last phase. Is eosinophil and mast cells, critical cells in something. Features are important, but different concepts like asthma, but then you find that the eosinophil and mast cells. So when you catch a eosinophil, I mean, it happens with this schematic, it's very, very nasty looking cells. A lot of them. Why significant of imagine this goes into your lung, goes into your intestine. In the amount of damage it can produce, it is just on with that. With allergy, it's very easy problem because it is part of releasing all these different chemicals. Then we have the other strength, our master. Let's there's a lot of chemicals, 60 odd chemicals in the master, very quick activated, it reduces all the chemicals, they are hard, but really causing a lot of damage, and this is naturally release of the person will get anaphylaxis and can lose their life. So that is the one we try to avoid. If the person has mild allergy, we won't allow them to go into a state of anaphylaxis. When patients come to 3 weeks, especially with a urticaria or with an angioedema swelling, we don't neglect that because if we neglect that, the allergy process, the hospital starts working and then we end up with a person ended up 5 months, 6 months, 1 year down the line, getting hospital. And then that's a very difficult cycle to break because you're getting very frequent. So these are the chemicals that are released in the master. And also remember that histamine is not the only chemical released by the master. Everyone focuses only on histamine. There are a whole lot of other chemicals, leukotrienes, that's why we sometimes want to lose cars, prostaglandins, etc. So we have a drug with some prostaglandin blockage action, etc. in this list. So what happens with standard allergen? You have an allergen, it is an innocuous thing in the environment or what we infect or drugs that we take. That comes, binds to the IgE on the master. The person has to be sensitized. Right? You have to see it before, you have to be sensitized, and then when it binds to the master to the IgE, you find the signal goes in, all those chemicals are released, and then the person gets developed allergic reaction. For whole range, it can be the skin, it can be the guts, it can be in the lung, etc., which I will talk to you a bit later. And the important thing to remember is there are two chemicals that are released, especially in anaphylaxis. One is histamine and the other one is tryptase. Now, in Sri Lanka, we find it difficult to get tryptase done in a sort of a whole situation because of the first element, etc. But in the future, you have to do a serum tryptase level if a person goes with severe allergic symptoms in the A&E, because it helps the allergist so much in the future. Because you do a serum tryptase and we find it to the elevator, okay, you can like this. You do a baseline intake because if it has not come down, you have to think of mastocytosis, but if it has come down, it is so this is a test that we find easy to get in the UK compared to Sri Lanka because of cost element, but that's an important allergy test to remember. You don't measure histamine, but you measure tryptase, tryptase. So if I put the Hill and Coombs or whatever they call it now, the classification that is more and more people lost into the complex diagram, I don't want complex, that is type 1 allergy. Anaphylaxis, type 1 allergy. But when it comes to allergic manifestation, right, you can have a full range, type 1 to type whatever, right, 5 plus, etc. So the important thing to remember is that some allergic manifestation like this, which is whole pupil antihistamine, is dermatology. These are the very severe ones, even Johnson, etc., mediated. This is not IgE. This is type 4, if you can remember from a medical school vaccine. But the type 1 IgE mediated is the histamine, etc., which is treated antihistamine and attenuation, etc. So, very, very important thing to remember with regards to these different classifications of what causes allergies. Now, the problem in the community is anything the person gets, even if they are known category for that whole category, they say allergic. They know about the allergies. And if they don't like a person, they say that they are allergic to that person, right? So, I mean, that is so you have to take a good history. That's so important to really find out, does the person really have allergies or is this not something that is true allergy? So, as I told you. So, allergic reaction, what can it occur to? It can be injection, injection or inhalation. And you know the typical thing, what's inhalation, the pollen dust, mold, animal, and the whole stuff might be the major problem in Sri Lanka, right? Mold might occur, major, after. When it comes to food, etc., our pattern tends to differ from that seen in the rest countries. We have a different pattern. So let's look at aeroallergen sensitization. This is was extremely common at this time of the year in the UK because of the modern extremely common. Right? Children have a big problem. They are O-levels and A-levels at this time, and when they get hay fever, they are struggling, how can they concentrate, and then people go and listen to it on every day, and then working the performance, because you take on every day for 5 performance papers and top. But to be great, except we must be non-allergic ordering antihistamine. So this is a big problem. 2, we don't accept, right? We don't follow, we will get pollen. Which is the bigger problem is because we change the environment. Now we all close our windows, don't open our windows, we carpets in until we use carpets, heavy curtains, and And then we have mites all around everywhere, and we get a lot of house dust mites, and we have our AC, we are not serviced properly, we get a lot of house dust. We are swimming in most this has been lots of people when they get up in the morning, they're sleeping away because the they are being a big exposure because they are really not our ventilation systems are really weak. And these are the symptoms that can't be identified in this person like that. So these are the problems that can occur. You can imagine the issues that can occur when you have allergic. You can see the swelling, is there. It is over there. These are the suburbs. We can't concept. Right? It just cannot concept it. And the issue with this is we have a concept in allergy called United Airways. Not the airline, but the airways are connected. If you have this information in your physical strategy, where is it going down? It's going to your lung. You are predisposing the person to get asthma. If you don't take this concept properly, you are going to predispose the person to go and develop asthma, and that is the danger. This is not the dangerous factor. Because it won't feel danger. The dangerous factor is the asthma, etc., which will feel the person. Right? So that is the important factor. If one aeroallergen sensitization and aeroallergen each month effectively, because otherwise you're storing something for the future. So that is big problems around the world, including Sri Lanka, and we have to remember that there is food allergy. One is immune related. I won't go into great detail, but it's IgE related and other types of food allergy. But there is non-allergic food hypersensitivity. And this is very important to remember because there is lactose involved. Right? Asians and the Chinese cannot tolerate lactose, like the Europeans. Right? They can't tolerate lactose. So therefore, after about 30, especially in India, you cannot drink a glass of milk without putting on top of it. The patients come and they have abdominal symptoms, etc. And you can't transmit milk allergy to the patient because lactose intolerance is common. Histamine intolerance is the other one. If you're producing histamine and the histamine is not being broken down, then again you can have bigger manifestations because the allergy manifestation is histamine and leukotrienes dominantly. That's why we use antihistamines and leukotrienes to stop the disease. So don't forget about intolerances, etc., which are very harmful in the body. So food allergy, as we say, food allergy is an immune response, IV response. Now, why am I specifying that? You don't die of lactose intolerance, but you can die of food allergic severe reaction. That's the important thing. If you diagnose a food allergy, you have to treat it effectively, give the steps to prevent that death of it, right? Or giving a normalcy, but you don't die of intolerance, right? So, not every case is ignore it. It's easy to get cause a lot of problems with cases, but we give in few different ways in this practice. So, children and adults have different allergens. We know peanut is a problem in the case, I've this problem here, PhD, and lot of vegetables, etc., etc. So the picture is what I was feeling about new allergies, quite common. They can't eat beef, they can not eat, but they need to can know why, right? So that is a common, so that we see, in language, because of eating done. If you don't take a fish today and have a reaction after about 5 days and say, it is feedback. That is not. It is not like they're having something today and taking something 6 months after and saying it's feasible actually. Right? So, if you have to have a proper temporal profile, right? If you generally eating about the lot, you can get local symptoms. You don't want to get systemic symptoms where we have systemic symptoms as a lung, severe lung impairment. There is something called oral abscess in India. I don't want to great detail information in Sri Lanka, but it's a big problem in India. Because as pollen allergy comes in, the protein in the pollen is very similar to some protein in food. So therefore, when they get food, the raw fish, they get to think quite practical mild system, but it's some people of common symptom. And therefore, the primary care symptoms should be to be able to identify it because when they can use it out, Because when the problem is due to birch pollen, the pollen of dark pollen, rather than the sick person who can take it up. We still don't have a lot of it here at the moment because we don't have like a pollen. But that will happen. That will happen. Remember, 20 of years ago, the counters of your players and which was suggest that copy, I got an allergy, no one of it. No one of it. They are into those marks. Now, and we take the so, this is overall, I won't go into great details, symptoms, and what they but remember, it's for taking some aid, and they have safety effects of that, especially people visiting from the toilet, some other, just think of the several lines in there, because you can identify it, it's very interesting to right style okay. Food intolerances, remember that food intolerance is common, and it has to be differentiated from things like food allergy, because it causes a lot of problems. Causing of a morbidity, and we can take effectively by removing certain items of the patient. Like food allergy is dangerous, and the testing is quite different. Food intolerance is going to spend lots of money correctly investigating that the food allergy pathway because it is wasting a lot of money when it is just a intolerance, and you can just remove that fish or tricks for the food needs you can remove that. And then let's engage the drug allergy. Which drugs they are even for any immunologist allergies around the world. There is no drug because we get different patients coming, react to the drink, react to that, and some patients come with reacting to 30 drugs and what we do. First important thing what we want to do with the patient is some practical point. Next the patient we are coming to have a data to much allergy. Just go ahead. Because that completely will not prosper. Then you have 100 based on allergy. Then we will go and tell the unit of the based on allergy, you don't need anything. Why didn't the patient put in it? But when you go into the point, it's an antibiotic, two antibiotics. Also, treatment shows that they are contaminated. So, you have take 7 classes of antibiotics, which they can't tolerate inside, you can have a time. So just a very important thing to remember. And then the other important thing is that dystonic reaction, the second goes to the allergy. There's actually another issue that comes in when it comes to thinking about allergic reactions. The third one is if you are referring, when we get a patient with allergic medication allergy, the first referral to get is this person allergic to medicine, we investigate. Or we get it from a surgeon. And we really need the drug. Because if you don't know the drug, how can you tell? Right, that's number one. And second thing is, the next important point is, we want to get solutions to the drug. Right? If the person comes and tells you, they are allergic, or whether they are allergic to the sweet state, that surgeon says, well, anesthetic, we want to get solution. What will we need for the next topic? That's what we want to do. We don't want to just only confirm. We want to get solution. This time we will say, it's not the right. This it's not a family. That's what the doctor expected of. And you generally like to speak to the anesthetic rather than the surgeon. The surgeon will have 5 minutes talking about these doctors and the doctor and the patient. So all this document doctor patient and so because it's so much easier initiative first. That is very important in the so these are the different reasons. I won't go into this because we have to change and such and so on. It's very common. Extremely common large. That is allergy. So if you just come and say, don't worry. You can find more GC drugs for you to use. You want everything, right? And the different structures. Just because you react to the transparency doesn't mean that it's for me now, right? Completely different. That's possible to begin. It's important. Basically, the distract. I'm allergic, accommodating allergic. We have to must be drug allergic. No, that's not fair. You have the allergic, you have an allergic. Now you can have not something they have to be drug allergic, right? So that should be important. Next thing is, parents come and we just hear and say, my elder son had this allergy, I think I must take all the drugs in my younger brother. Right? And if you face now, in 5 years' time, we will take it. So you might say they are not allergic now or sensitive, and in 5 years' time they might become sensitive. It's up to you. Another common thing is I lived 60 years and I never had any allergy, but now I have an allergy. And I can live up to 80 years and get allergy. Yeah, right? Because when just because we get an allergy at 60 years, that is only the allergy and get allergy to anything. Right? So those are the important indicators in faster in the patient. Yeah. And allergy to anything and exposed separately more in the test for percentage or the alternatives. Inconvenience has a bigger risk of solution because the load is very much higher. Right? So if you very much over the investor, the high chance of high and then specific college are going to institute of solution. We find a solution to them when they have secured. The important thing to remember now is jealousy and so those are absolutely people do not take those, which we are seeing in basically patient especially vaccine these are Irish colloids and local anesthesia. Again, remember local anesthesia. Local anesthesia is there. Now people will come and say there's a local anesthesia what allergy. Extremely rare. What I generally encourage people is don't use adrenaline because it's a reaction. When it's likely to actually because of the breathing of air, don't use absolutely in the brain, it can cause it because of itself. So don't use that actually. But local anesthesia is very, very rare. In this case, not an allergy. It is salicylate sensitive. Lots of people say I'm allergic to aspirin and also it's a sensitive. Then different pathway because it's not the ideal mechanism. It is the prostaglandin mechanism. Due to if you get prostaglandin pathways affected and causes particular bronchospasm, and then that you see that in a different way, sometimes something that is so again going again because asthma and just remember that in this case, the asthma can be affected because that's important. So what are the signs to prevent? The signs to prevent anaphylaxis. These are the common causes of anaphylaxis that we have. In the UK, it's always started by food, infection, drug, laser scans. Idiopathic now it's called spontaneous because of satellite idiopathic. We don't need to get idiopathic now because the connected, but it's spontaneous. And these are the different agents in Sri Lanka, the different list of suspect cause and angioedema urticaria, very common way. Again, important thing is urticaria is common. We treat it properly. Because if we don't treat it, then we can proceed to go on the developing angioedema and urticaria. We can get those together. And the issue with angioedema is that if it starts spreading inside your throat or except or lip, tongue, etc., that's the way you can get into problems and going to anaphylaxis, etc. So identify the figures, treat them appropriately, treat them for the correct length of time. And lots of people, when they get better in 1 week, they want structural medicine, and that's the issue that can happen. And you can see the picture. And some of these look very frightening, but we don't want this to occur. So it's a danger of we can use the patient. There is one concern for mast cell activation disorder, systemic intolerance. I told you this condition. With your condition, we have multiple fields, vaccine causes, even virologists, and environments to keep slide because the factor primary platform so important here because of the interaction between multiple specialists and coordinating care, etc. Where the first turn that patient makes with the primary care because they can just impact cause the Alexander syndrome, the hypermobility, etc. Diagnostic aspects quickly are run through pre-pick test and IV testing. In-pick testing appropriately. They have to be off antihistamine. Some patients don't need in-pick testing, can do blood testing, but in-pick testing, if they are off and we can do it to appropriate allergen. Blood testing is less sensitive. For children, it's sometimes easier to do blood testing, but don't do these massive panels which of no use to anyone. Right? 60 panels, and then the patient says they are allergic to 40 euros, something like that, which there's no relevance at all. So targeted testing. That's the important thing. Please do targeted testing in this group of patients. So this is the way that we skin testing, very easy way to do skin testing, but again, targeted skin testing rather than doing overall skin testing. Then finally, I will come into the management part. Remember, each your nasal spray, antihistamines, etc. appropriately, and in the correct technique. That's an important. Like in the technique of a asthma inhaler, you must respect the technique of a nasal spray properly. Otherwise, you're not going to get the proper benefits of it. That is desensitization, but again, we can that will not come in a strict way because the wrong person. 3 years, 10 days. I have some patients who have got it sent in Singapore, you can just come back here, but it's not a big deal. People have to pay them around. No property being desensitized for 3 months, and you're freezing no one, right? You're freezing not freezing losses or doing anything. It's the waste of money. So it is 3-year program. We have over desensitized. Desensitized is only curative treatment for allergic. That's the only one. And these coming, if you want all these are symptomatic treatment, just need symptomatic, but and you expect the body to revert to normal, but desensitized is the only curative one, especially following and body treatment. If it is food allergy, good avoidance measure, written treatment plan, and the other thing is if you can, big problem is getting evidence here because when the film is expiring in the UK, they allow them to import the pen here with a 3 months or 4 months expired. The first thing every time they're spending ₹1,000 for getting a 1 for 4 months. Right? That has to be some level of control that you have to advocate to 18 months to a year. Right? And that is a very sad thing because the person is paying every 3 months that they're paying 10,000 into that amount a month for getting that just one single thing. So it depends that you have a dark and high pen, etc., and you in the appropriate age, you have to put the appropriate, etc. So what I have done here, this quick talk, right? Spoken about the basic aspects and allergies and how it's a abnormal response of the body to innocuous thing. Spoke about aero allergens. Don't neglect that because of predisposed that person to go and with your asthma later on. Food allergy, dark allergy, dark allergy, only from take home kids. Anaphylaxis, angioedema, that's what we really want to prevent anaphylaxis because getting to anaphylaxis, decorating the patient with pen gets a because that is not what you want to do. You want to prevent that, right? And then the diagnostic aspect in picture and blood testing, but history is the most important. Management, targeted management in the association. Thank you.